Hearing loss is a common condition across the age span. So we see it in newborn babies, and we can test newborn babies now, and we see hearing loss all the way into aging adults. Traditionally, ENTs have really focused on treating hearing loss when it was the primary complaint. And what we're seeing in this new healthcare environment is a paradigm shift where we want to have interventional audiology in these practices. And what that means is we're going to focus on hearing loss and how it's impacting healthcare in general for a patient. So we want to improve their communication and not even focus on hearing loss so much, but its impact on communication so they can then adhere to their instructions. We can improve cognitive ability with people if we can focus on these things. And there are a lot of data to support that now. So it's an exciting time for ENT practices to reach out and become important in all different clinics. Hearing loss is going to create a communication problem. The consequence of a communication problem can be cognitive decline, it can be social isolation. So those two then move on to causing depression, an increased risk of falls, and institutionalization. And so if we want to impact those, we need to impact hearing first, and we can impact some of those which can be very negative health outcomes. ENT groups have not normally focused on prevention. We really were more reactionary. If someone has a hearing loss, has some kind of trauma, we deal with that and we help them. But we want to shift and also think of what can we prevent. We can prevent noise-induced hearing loss. This is a great place for ENT practices to get involved in the community. The UPMC Audiology and ENT Center set up the Musicians Hearing Program in 2003 and to do just that. So we work with professional musicians, but we work with most of the area high school band and orchestra students now to provide hearing protection and create better hearing health habits. We can also look at prevention of misdiagnosis. A study that was done here at UPMC took a group of normally cognitive functioning people and gave them simulated hearing loss and looked at tests of dementia, and they actually come out looking as if they have dementia even though we know they don't. So audibility plays a really important role in the kind of testing that other professionals do. So we want our ENT practices interacting with the general practitioners, internists, and geriatricians to make sure they're solving audibility problems, hearing problems, before they're making other kinds of diagnoses. Hearing loss crosses all dimensions of healthcare, and I think we're only just appreciating that, and this is a great time for ENT practices to position themselves to be there for the general practitioners, internists, geriatricians, and the inpatient care to get that information out about what we can do about hearing loss. We can treat it with amplification, we can treat it with communication strategies to then help people access their healthcare.